It's slightly higher at time of ovulation when pregnant. I just want to add in here what I have included is hormones, which would be part of the menstrual cycle here, okay? Sorry, I'm just trying to match this up. And then the oral cavity temperature is regulated to ingestions of hot and cold substances. And also a smoker would have an effect with the temperature. So assessment of temperature, the sites that can be taken are oral, which is the most common, rectal is the most accurate, axillary is the least accurate, and then you have tympanic, which would be in the ear. And as far as equipment, you have thermometers that are glass mercury, you have electronic, you have a tympanic membrane measure, and disposable paper. Also temperature sensitive strips. I went to the doctor with my sister and they just ran this like little thing over her forehead. It looked like an ultrasound thing, just real quick, and got her her temperature. It was just like, wow, that's pretty cool. Okay. We're going to do our practicing in lab today, so I'm just going to present this lecture. Heart rate is also known as HR, or your pulse, and it's measured in beats per minute. And what does the pulse measure? The contraction of ventricles when it ejects the blood into the arteries. It's the force of blood in the aorta from the left ventricle causes distension of the elastic wall.
We don't have any of that.
We don't have any of that.
Okay. Indirect measure of contraction of the left ventricle apart. You have that, right? It indicates the rate at which the heart is beating is next.
Yep.
Okay. The movement of blood in the artery, which is can be palpated at various sites. Okay, well, let me just talk about the pulse measure, okay? So you can add this if you want to write it on the side, or whatever you want to do. It's the contraction of ventricles that ejects blood to the arteries. And it forces the blood in the aorta from the left ventricle, and it causes distension of the elastic walls.
Contraction of ventricles that eject blood to the arteries, something with the aorta?
Distension. Force of blood from left ventricle
Oh yeah, that's what
causes distension of elastic wall. Okay?
Thank you.
As the aortic wall expands, it contracts. The pulse wave is created and it travels along the vessels. This is in your medical terminology book if you want to look at how your heart contracts. And then the pulse, what you feel is a throb, a tap. It's palpable, meaning you can touch it, you can feel it, where the arteries lie close to the skin surface. Okay. Characteristics of the heart rate is the rate and frequency. You can have tachycardia is greater than 100 beats per minute. Bradycardia is less than 60 beats per minute. And it may be normal in trained athletes. Like my normal resting heart rate is like 62. So most people, the average is 72. So that's why it's important to know what person's normal heart rate is as you're working with them, and you have to monitor their heart rate during exercise if they're a cardiac patient. Some characteristics of the heart rate are the Rhythm. Rhythm means the regularity. It's evenly spaced intervals. If it's regularly irregular, it's irregular rhythm with consistent pattern. So someone can have an irregular heart rate. It might go dun 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 dun. Okay, when you're feeling the pulse, that's how you're going to feel it. So that's just the way their heart beats. Okay?